Our country has long been split along ideologic lines on whether people get sick because they make bad decisions or because we have a bad system that makes people sicker. Rudolf Virchow, an esteemed 19th century physician who pioneered the modern concept of disease, once said, "Medicine is a social science," especially when he linked outbreaks of typhus to poverty and politics. And the real pre-existing condition in American healthcare isn't biology, it's power. Welcome to PCP Lens, where we journey through metrics, money, and madness. My name is Sudeep Bansal. I'm a primary care physician in Connecticut, and I run my own medical practice. In the last 10 to 15 years, we've made significant progress in understanding the social determinants of health, which are defined as the conditions in which people are born, grow, live, work, and age. However, socioeconomic determinants of health is a manifestation of deeper causes. I discussed two of these deeper causes in my last two videos on commercial determinants of health and the political determinants of health. In this video, I'll look at the societal infrastructure frameworks and systems that lay the groundwork for the emergence of socioeconomic determinants of health, which then affects health outcomes. These frameworks are referred to as the structural determinants of health. Let's dive in. WHO defines structural determinants of health as the societal, economic, and political mechanisms that generate and maintain social stratification and inequities in society. In another paper published in 2024, Heller and colleagues proposed a two-part definition. The structural determinants of health are the written and unwritten rules that create a hierarchical pattern affecting health. And they represent power relations between groups, where groups with more power maintain an advantage by reinforcing or modifying rules that benefit them. Essentially, what structural determinants of health mean is that they are power plays of the past, where policy is codified to rig the odds in favor of those in power. Think about it this way. These are historical decisions, that is, past choices, the impact of which can be felt today. This impact is due to the visible and hidden rules that govern our day-to-day lives. And these rules lead to a power imbalance favoring those in power. Well, enough about definitions. Let's see how structural determinants work in real life. Political decisions set rules through policies, as I discussed in my last video on political determinants of health. These policies create or do not create the infrastructure for resource distribution. These resources or lack of these resources determine the social determinants of health, that is where people live, work, and play. And finally, commercial actors swoop in to exploit those vulnerable populations. And then the cycle continues as the commercial actors become more powerful, they capture the regulatory system and start rigging the rules in their favor. Let's take the example of zoning policies to illustrate how the structural determinants of health cause poor outcomes. Single-family zoning rules create structural barriers by increasing house prices. Low-income families are unable to purchase homes and are pushed to cheaper areas, leading to segregation. These cheaper areas often do not have access to healthier food, and commercial actors like fast food companies swoop in to provide access to cheap, unhealthy food. This then leads to obesity and poor health outcomes in these communities. Now, if you're interested, there's a more detailed flowchart explaining this on the PCP Lens website. After hearing this, the question you may be thinking probably is, how and why did we get here? Why did we make the choices in the past that led to the emergence of infrastructure that serves a few at the expense of others? Well, it's because the choices of the past constrain the choices of the present. This is called path dependence. That is, historical decisions shape our current institutions, and each institution is built upon the previous one. Francis Fukuyama, in his seminal work Political Order and Political Decay, explains path dependency as, institutions are often like turtles standing on top of other turtles, which themselves are standing on top of more turtles, with no solid ground in sight. Which means that we have to briefly take a look at US history. Now, for many of you, this may be something that you learned in school, but it warrants a quick review and putting history in the context of structural determinants of health. In the colonial era of land distribution, private property regimes favored white settlers and systematically excluded indigenous and enslaved populations. This was then followed by the institution of slavery, which created a racialized caste system encoded in law and the economy. This institutionalized inequality led to poor labor conditions, housing, and health outcomes. The 1862 Homestead Act prevented accumulation of wealth in black people through restriction of land ownership. This created intergenerational disadvantages in wealth and housing. In 1877, Jim Crow laws were allowed to flourish, which blocked structural investments in black communities. The 1935 Social Security Act continued its exclusionary policies by denying benefits to many black and Latin American workers. The 1930s Federal Housing Authority's redlining practices encouraged racial segregation and disinvestment. After World War II, due to rising inflation, the government implemented wage freezes. So employers started attracting people looking for jobs providing health insurance as an ancillary benefit. This was the genesis of employer-based insurance in the United States, linking healthcare access to employment status. This was then further codified by granting employers tax benefits for providing health insurance. The 1944 GI Bill to help veterans readjust to post-war life in practice enabled white veterans grow their wealth by getting easier access to education and housing, while excluding minorities. In 1945, the proposal to pass a national health insurance plan failed due to opposition from the American Medical Association, insurance companies, and concerns about government control. In 1965, Medicare and Medicaid were passed without universal coverage. While this provided a crucial safety net to people who were retired or were living in poverty, it reinforced the fragmented access to healthcare. In 1994, the Clinton health reform failed due to strong lobbying efforts by the entrenched private insurance companies. This also deterred future large-scale reforms for more than 2 decades. In 2010, the Affordable Care Act was passed. However, several southern states rejected Medicaid expansion, maintaining coverage gaps, reinforcing racial and regional disparities. And finally, the COVID-19 pandemic exposed the fragmented public health infrastructure, leading to higher deaths in America than in other developed nations. There's enough blood spilled online and in textbooks about the original sin of slavery, and that we should not be beholden to the past by promoting a victim mentality. However, to understand our current situation, it is essential to look at these historical events and how our past choices have shaped the society in which we live in today. And while as a country we've made tremendous progress, this progress has been unequally distributed. These persistent disparities are the structural determinants of health, which manifest as socioeconomic determinants of health. Let's use housing as an example of how historical decisions play a role in creating the structural determinants of health today, leading to poor health outcomes. And the reason why I'm using housing is because many authorities consider housing to be an anchor determinant. That is, it forms a foundation for all social determinants of health. Because of local taxation policies, housing determines access to resources and services, such as education, healthy food, walking and bike lanes, essentially the quality of a good neighborhood. And the lack of these resources then leads to poor health outcomes. With this background, let's trace US history and the path dependency for housing policies. In the 1930s, the Homeowners Loan Corporation created maps grading neighborhoods by risk. Black, immigrant, and low-income areas were marked in red as hazardous. The Federal Housing Administration then refused to insure mortgages in redlined areas while subsidizing loans in white, green-lined suburbs. Massive federal investment flowed to white neighborhoods while black and minority families were systematically excluded from homeownership. Banks and real estate companies actively enforced and profited from redlining by making it harder for black and minority buyers to purchase homes. This was predominantly by steering people into predatory contracts, extracting any wealth that they already had. Developers and builders lobbied for zoning that protected high home values and market exclusivity in white suburbs. This led to policies favoring single-family-only zoning and minimum lot sizes, which kept lower-income and non-white residents, reinforcing segregation. Without access to mortgage or public investment, the neighborhood infrastructure crumbled in former redlined areas. Property values stagnated or fell, draining wealth from communities of color. Retailers and grocery chains then avoid these neighborhoods due to market risk, which creates food deserts and fewer economic opportunities for people. This path dependency makes it easier for white families to build intergenerational wealth through home ownership, while putting multiple roadblocks in front of black and minority families, effectively denying many of them this primary wealth-building opportunities. And this racial wealth gap continues to still persist today. Now, I'm fully aware that it's becoming harder and harder for people, irrespective of skin color, to own a home. This is because racial segregation is slowly morphing into class-based segregation. Since local funding is tied to local house taxes, the current system leads to underfunded schools, which results in limited education opportunities, fewer jobs, and poor infrastructure in formerly redlined communities. Commercial actors swoop in to exploit vulnerable populations as there's now a market opportunity. Check cashing stores, liquor outlets, payday lenders, and unhealthy fast food chains flood these vulnerable neighborhoods while banks and supermarkets stay away. These commercial actors profit from limited consumer options, deepening health and financial harms. So if you're poor, your opportunities to break the cycle of poverty is becoming harder and harder. Due to all these historical factors and path-dependent decisions, people living in formerly redlined areas experience higher rates of chronic illness, shorter life expectancy, poorer mental health, and have less access to both healthy food and to healthcare. Now, at the beginning of this video, I mentioned that a country split along ideological lines on whether people get sick by making bad decisions or because we have a bad system that makes people sicker. And I think both factors play a role, but there's no denying that structural barriers such as political actions and unchecked capitalism lead to people being trapped in poverty. In recognition of these structural barriers, the Minneapolis 2040 land use reform aims to redo the zoning policies. The new policies are designed to increase housing choices by developing multifamily housing units and mixed-use neighborhoods. There's already some early evidence that these policies are leading to more affordable housing. Unfortunately, the impact of these policies on health will take decades to tease out. Human history is replete with power plays. Entrenched interests use their power to reinforce or modify rules that benefit them, solidifying their advantage and limiting opportunities for marginalized groups. Reducing inequities therefore involves changing the power structure in society to benefit the disadvantaged population. And this threatens those in power, pitting the interests of social groups against each other for control of resources. This leads to the exploitation of the us versus them mentality. Therefore, without collective action, individuals and communities with fewer resources are structurally disadvantaged, which in turn leads to poorer health outcomes. This is also why voter enablement and suppression tactics are a centerpiece of American politics. They are a power play. So, in summary, the historical events that shape the power structure of society continue to influence the us versus them mentality today. What started off as race-based unequal system has morphed into a both race and class-based inequality, where the wealthy elite shape laws to maintain their power at the expense of those living in poverty. These power plays lead to fragmented infrastructure, which maintains structural advantages for people who are wealthy while denying access to resources for the poor. Due to path dependency, people with entrenched interests and powers continue to influence laws to maintain their advantage. And these entrenched interests can be regular people like us. Imagine a local zoning meeting to incorporate multifamily housing. Most of us don't want that in our backyard, as building affordable housing will decrease our house prices. When I started writing and making these videos on the determinants of health, I did not anticipate that some of the information would become so overtly political. But here we are. The health of the population is inherently political. The best way to improve the health of the population is to challenge the entrenched interests by voting, to help elect leaders that will help create economic opportunity for everyone, and this will eventually lead to better health outcomes for the population. And if you watched my first video from Doctors to Social Workers, the concept of population health was a political concept, not an economic one to buy and sell our health in the marketplace. Holding doctors accountable under value-based care is not the answer. We need to build infrastructure to take care of the vulnerable, because good infrastructure benefits all of us. You can find a written version with references to the material and audio podcast version on PCPLens.com. If you like this video, please sign up on PCPLens.com so that you don't miss the next episode when it's published. Thank you for watching this video. Take care and goodbye.